Hi, I'm Dr. Gina Hahn. I am a physical therapist here at FXPT. Good reasons to come see a pelvic floor physical therapist include any abdominal surgery that you might have had now or in your past, having had a baby, or changes in your bladder function, changes in your bowel function, or changes in your sexual health. If you're coming for pelvic floor physical therapy, don't be scared. Everything happens in a private room. You get time to tell your story. Everything is confidential. And we want to hold space for the fact that this is an intimate thing that you're likely dealing with. And so we definitely bring you in and make sure that you feel safe and cared for. The other thing that is important amongst pelvic floor PT is the collaboration that we do with other providers. So whomever might have sent you to physical therapy, or if we are deciding now that you might need to see somebody else, we try to make those warm referrals so that you have a good care team around you to help with your symptoms. So every physical therapy assessment should start with your story. I want to know what symptoms you're having. I want to know how long they've been going on. Was there an event that occurred? Are the symptoms changing? Are they improving? Are they staying the same? Are they getting worse? So part of my job is to be a detective and to ask you a lot of questions. So come prepared to really give some detailed information. Your story helps to guide me, as well as any other pelvic floor PT within our company, as to where we might go in our then physical assessment with you. As physical therapists, we are movement experts. So first, I want to see big movements. So can you touch your toes? Can you lean back? What does a squat look like? How does it feel for you? Can you balance on one leg? All of that gives me information as to what might be happening in your core, and your pelvis is a part of your core. So these big movements, you experience them all day long. Do they provoke your pain? Do they help relieve your pain? All of this information helps to guide, again, what might be going on so that we can help better treat you. So the biggest difference in a pelvic floor physical therapy setting is that there is an option for an internal pelvic exam. That is something that requires your consent and for you to feel like you're in a safe space to want to say yes to that. An internal pelvic exam gives the physical therapist information as to what's going on within the pelvis. So this is an intravaginal exam or an interrectal exam. We can assess the strength of your pelvic floor, the endurance, if there might be some pain points. Just like anywhere else in the body, a muscle that is tight and not moving well, or it's not strong, is not functioning well. So the pelvic exam can give us information regarding this part of your body. Sometimes this is done on the first visit, sometimes it's done on the second visit, sometimes it's not done at all. Your symptoms will help guide whether we need to do this part of the assessment, as well as your comfort level. Once we gather all this data information, starting from your story to the big movements to the little movements and potentially a pelvic exam, now we can put together a plan. What is going to be helpful for you so that we can move from where you are now to where you want to be? Please come see a pelvic floor physical therapist so that we can help you gain back function and control over this part of your body.